walking you through the training module number 1. What we're going to be going over today is the growing allergy market, why allergies are getting so bad. First of all, let's talk about primary care. What is the Allergyworx program? It's the first evidence-based allergy program specifically designed for the primary care market. Now what that is it's an Allergyworx 72 test kit, environmental kit, and it's combined with the Allergyworx sublingual immunotherapy, which replaces allergy shots. With the 72 test kit, it's a needle-free test kit that is a national panel. So no matter where you're at, no matter Maine, Florida, California, Oregon, Seattle, Colorado, the panel is going to be the same. It's the top 70 allergies across the country. It's a pre-labeled program which is ready to fill. So it's a perfect, simple, easy solution for being able to test in a practice. The sublingual immunotherapy is also needle-free. It's universal, which means that everyone gets the same dose. It's also multi-regional, which also follows the same protocol as the national panel. So no matter where you live, it's going to be a multi-regional panel for sublingual immunotherapy and building a tolerance for immunoresponse to allergens that cause allergy symptoms. And it's down to $80 per month. So it's extremely affordable for patients to start this in a primary care setting. So now let's go over the allergy market itself. Statistical data shows that allergies is getting worse. It's now the fifth highest national chronic disease ranking in the U.S. And in 1986, 1 in every 4 Americans had allergies or asthma, which was 50 million at that time. Then we get up 20 years later. In 2006, 60 million cases. Then we get to 2007, where 54.6% of all U.S. citizens test positive to more than one allergen. 2010, over 50% of the homes tested had at least 6 detectable allergens, and the annual cost of allergens alone is nearly $7 billion. 6.7 of that is medication, which only treats symptoms. 300 million of that is office visits. Allergies and asthma is a major cause of work and school absenteeism and presenteeism, meaning that you're present physically, but mentally you're not there. 4 million work days lost each year, resulting in 700 million in lost productivity. But when you talk about allergies, you also have to talk about asthma because they are directly related. 34.1 million Americans diagnosed with asthma in their lifetime. That also has a 300 million worldwide allergy sufferers with 250,000 annual deaths, which is 685 deaths a day worldwide. In the U.S. in 2007, 3,447 deaths were recorded from asthma. That's 9.45 each day. About 70% of asthmatics are triggered by allergies. Now that statistic right there is extremely important because if you treat the allergies, 70% of the asthmatics that have problems with asthma goes away. The prevalence of asthma increased 75% from 1980 to 1994, and during that same period of time, asthma rates in kids under 5 increased from 160%. We're looking at the annual economic cost of asthma being $20 billion. That's direct costs make up $14.7 billion of that total, and indirect costs such as lost productivity for missing work or missing school add another $5 billion. Asthma accounts for 217,000 emergency room visits and 10.5 million physician office visits a year. That's a lot because whenever an asthma attack happens and they go to the emergency room, that is a $10,000 tab immediately. So let's take a look at what it does with primary care. 58% of patients seek help for allergy symptoms by providers who are not allergy specialists, which means they go to primary care. Each year, 17 million patients are diagnosed with allergic rhinitis alone. And if only 3% go to ENT, 16% go to pediatrics, which we consider primary care, 38% go to allergists, and 42% go to family practice. We get to 58% from the 16 plus 42. That means primary care are the first responders when it comes to allergies. So why not go ahead and teach primary care how to treat allergies in their practice? So now let's take a look at why more Americans than ever before are suffering from allergies. It is the country's most common yet overlooked disease state. And if we were to combine the 5 million Alzheimer's, 6 million stroke, 7 million congestive heart disease, 10 million cancer, 18 million diabetes, those combined still don't compete with the 60 million patients with allergies and asthma. So now let's take a look at what is causing allergies to spike. What's interesting is it's not just one problem, so it's hard to find a solution. But what we have done is we have simplified and standardized an industry, a therapy, and a testing protocol which has never been simple or standard before. So now let's take a look at what's causing these allergies to spike. What's interesting is there's not one problem, so it's hard to find one solution. But what we have done is we have simplified and standardized an industry, a therapy, and a testing protocol that has never been simple or standard before. So what you're going to find here is what's causing these allergies to spike is there's a combination of things that are creating this problem. First of all, let's talk about the current status. Right now, doctors who are in medical school are not going into an allergy specialist. So immunologists are becoming less and less prevalent, meaning that there are not enough allergists in primary care, which is who is going to have to handle that overload, who are prepared for this. So what happens is we have a supply of allergists expected to decline while the demand for allergists will increase by 35% by the year 2020. That's a lot. So that means primary care providers are the front line of defense for better allergy treatment and allergy care. Like we said in the previous slide, almost 60% of patients that suffer from allergies go to their primary care anyway. So why not go ahead and teach primary care the evidence protocol and program that we have here at Allergyworx that solves this particular problem by itself. So what we need to do is we need to be able to teach primary care providers on how to better identify, diagnose, and treat allergies. And in doing so, we provide a teaching tool that allows doctors to easily test, monitor, and treat allergies more effectively inside their practice. By doing so, we help doctors reorganize their clinic services to provide the necessary time and attention for primary care to provide complete allergy and asthma program inside the practice. And that's what Allergyworx has done. We have created a program that is simple, easy, and affordable and teaches doctors the basics of allergy prevention and allergy treatment in the primary care sector. So here's the other problem. Symptomatic allergy treatment. If you see a patient going into the primary care doctor, right now, most doctors simply say, "Oh, you got allergies, here's a script, good luck," and they kick them out the door. All that does is treat the symptom. It doesn't treat the allergy. So what they're doing is they're going right from a history and physical to a prescription without any testing, without any evidence, and that leads to misdiagnosis. So patients could be theoretically taking medication when they really don't even need to. This also does not prevent the progression of the disease to asthma. What we'll find in the progression of the disease later on in the module is it's pretty simple to stop the progression to asthma if you treat the disease itself as allergies. This also does not provide any avoidance measures for the allergies because nobody knows what's causing them. If you don't do any testing, how do you know what to avoid? If you don't know what to avoid, how can you tell the patient what's causing the problems and how to avoid those issues and reduce the amount of triggers that's causing their allergy symptoms? Now, here's an easy one: pollution. This is a pretty understandable issue because it's getting worse every year. Increased burning of fossil fuels creates more CO2 in the atmosphere. With more CO2, what do plants feed off of? CO2. So it makes it harder for us to breathe, but it also increases faster plant growth, earlier flowering, and greater production of pollen specifically in urban locations where you have a lot of CO2 content. For example, there was a 61% increased production of ragweed pollen in a 10-year period in metropolitan areas across the United States. That is a lot. So if you were to take a look at a comparison at how trends have gone in pollen production, if you look back around the 1900s, there was 280 parts per million. If you look in the year 2000, 370 parts per million, and expected in 2075, 720 ppm parts per million. So now we're seeing more and more exposure to pollen itself. Now, the picture down below, that's a ragweed. If you see this all over the place, and they literally are all over the place, regardless if in the middle of a parking lot, ragweed pollen grow, ragweeds grow. If it's in a field, you'll see these yellow flowers all over the place, which means ragweed is going crazy. So this is what it looks like on the inside. So this is what a ragweed pollen looks like on the inside, which is not very inviting. And now you understand why the body treats this as a foreign body and builds IgE antibodies to these particular proteins. Now, as we get higher CO2, we also get a global warming effect, which means more plants combined with a shorter winters and longer spring, summer, and fall seasons produces more allergenic pollen throughout the year. What this does is the spikes that would normally spike within the 3 or 4 day pollinating period now go from 3 days to 6 days to 12 days to 21 days. So now there's more pollen produced in the air over a longer period of time. So there's a much higher exposure to pollen. So when you take a look at these, from 1995 to 2011, you'll see a 12 days, plus 12 days, plus 14 days, plus 24 days, plus 26 days. It's getting worse and worse each year. And then here, when you take a look at the temperature rise in Europe, along with the days of pollination, for example, this particular ash tree, you're going to see an increase over time in the amount of pollens that's being dumped in the air. And then when you take a look at an example of Lincoln, Nebraska, you'll see that these peaks in the blue there is for trees. Now, as those pollination periods, peaks start to expand, you're seeing more and more pollen in the air. So now it transitions into grass in this summer, which transitions into weeds over the fall. So what we'll do is we'll take a look at a seasonal breakdown. When patients tell you they get sick every year, every Labor Day, or every spring, every summer, every fall, what they're doing there is they're giving you a clue of what could be causing the symptoms. However, the only way to get the confirmation or evidence-based significant confirmation of their allergy sensitivity is to test for environmental or inhalant triggers to find out what might be causing the allergy issue, the problem. So let's take a look at that. If you were to look at the spring, that's typically a tree pollen segment. So trees, you'll see early spring, you'll see a tree spike, and then you'll see a tree decrease, and then you'll see an increase as it gets closer to summer for grasses. So that's when grasses start pollinating. And then as summer starts to close, you're getting into fall, and then you're going to see a spike in weed pollination. Now, if you're looking at moist areas across the United States like Florida, Louisiana, Mississippi, Alabama, anywhere on the coast, or anywhere up in Washington, Oregon, Northern California, where you're going to find high moisture areas, you're also going to find high mold areas. And then when you go inside the house, these are considered year-round allergies. So indoor mold, you got them all year round. You got dust mites, you've also got pet dander, and you've also got cockroaches. So, for example, Chicago has an extremely high allergy and asthma rate in the winter because everyone's in the house. So let's take a look at genetics, the passing down of allergic predisposition to allergies. Well, technically, it's a predisposition of an immune system being passed down. If the parent is healthier, there's a high chance that the child will be healthier. But when you specifically talk about allergies, if one parent is allergic, there's a 30 to 40% chance of an allergic child. If both parents are allergic, there's a 70 to 80% chance of an allergic child. So let's take a quick quiz. When is the earliest time to test kid for allergies? Well, if you're a pediatrician, then you're going to say, anywhere between 6 months and a year and a half, depends on how still they can be with an allergy-free program. But that's not quite what I'm looking for. If you're going to have a predisposition to allergies, why don't you test the parents before the kids, specifically before the kids are born, specifically OBGYN? What can you give a pregnant mother that has allergies, anything other than sympathy? There are very few medications that are allowable for a pregnant mother to take that will treat those symptoms. So if you have allergies, why not go ahead and start treating with immunotherapy with a national project, which is allergy extracts, which are proteins. As you expose that immune system to the proteins, you're going to build a tolerance. That tolerance is therefore predisposition. So now you have increased the tolerance for the child. So that is really the earliest time you can test for allergies, is test the parents before you have kids. Now let's take a look at what's called the clean hypothesis. We're sanitizing ourselves to death by lowering exposure to building natural immunity. Now what does that mean? When we use commercial sanitizing agents, we also use a broad use of vaccinations or overuse of antibiotics, or we spend less time outside. And what we're doing is we're lowering the amount of exposure that our natural immune system has built and designed to protect us from. So if we decrease the amount of triggers and exposures, that means that our immune system either A, becomes more sensitive, or B, becomes lazy. So now it doesn't know how to react to these items once we become exposed. So we use these all the time. The key here is trying to develop an immune system that is extremely strong. For example, if you have kids that are raised in Lincoln, Nebraska, or Iowa, anywhere on the farm in Kansas, you're going to see rock solid immune systems. If you see kids that are in metropolitan areas, you're going to see very weak immune systems. So that's directly tied to exposure. Adrenal fatigue is another cause. Environmental stress weakening the immune system enough to where you become allergic with no history of allergies. This is what they call the immune threshold, and we'll learn about that later in another module. But basically, living stress at home or at the office is a constant exposure to stress. Our flight or fight response with the adrenal gland is specific to a quick spike to get away or to fight. But constant stress causes constant adrenal fatigue, where we just end up not being able to handle the stress anymore. Physical stress, it's emotional stress, we're talking financial stress, any kind of stress, oxidative stress, any stress lowers our threshold. So the first sign of adrenal fatigue is allergies in patients who never had them before. It is an early sign of stress. So now we see another problem. 70% of America is overweight and 35% is now obese. Approximately 30% of adult onset asthma cases are triggered by allergies, which is a statistic that may be tied to concurrently rising obesity rates. Adults who are obese had a higher rate of asthma than those who maintained normal weight, and there's been a concurrent rise in allergies, atopic dermatitis, and asthma that parallels this rise in obesity, which is thought to be the result of an increased inflammatory response. So what has it done to our kids? Obesity epidemic in children from an obesity had higher IgE levels. What we found was an interesting study that obese children were 26% more likely to have allergies than children of normal weight. Systemic inflammation commonly experienced by overweight individuals may also contribute to the development of allergies. Now, how they figured this out was a little interesting. What they were doing is they were testing for kids for IgE levels. And what they did is they used a body mass index scale for determining the weight categories. And what they did is they found that kids with allergies and asthma whose BMI fell in or above the 95th percentile were also obese. So there is a direct link from the obesity rate directly to the allergy and asthma rate. And not only that, just as worldwide, as of 2010, for the first time ever in history, a child's life expectancy is lower than their parents'. And so this trend is getting worse, not only for the health of the immune system, but for the health of a child and for health of the child across the board. So if we take a look of lack of nutrition, what's causing this issue with weight is a lack of a balanced diet, and essential nutrition is basically lacking. And we basically as a country has forgotten what is good to eat for us. Poor diets cause high oxidation level, and oxidation is the basis for all aging and disease. So what we've done, we are eating the wrong foods, and by doing so, low antioxidant levels, low omega-3 fatty acids, low vitamins and minerals, and they have a long-lasting influence on systemic inflammation. Diets high in sugar cause massive cell damage and chronic inflammation, which leads to chronic pain, arthritis, allergies, asthma, obesity, and hormone imbalance. So now you see why we're trying to add our WeightWorks program into the Allergyworx program, because the more you treat the immune system and you prepare the body to be able to repair itself, then the better outcomes you have. That also means that an unhealthy diet and a lack of physical activity also is linked to the high rates of allergies and asthma. So let's take a look at the trends. When you combine all of the problems that we just went over, let's take at the trends as far as the infectious disease. It's dropping. Over time, we're doing well. The problem is, by being able to treat these infectious disease issues, we have now increased inflammatory response of our immune system. So now all the inflammatory diseases such as Crohn's disease, which is directly related to gut-barrier issues or food allergies, type 1 diabetes, which is directly related to weight, multiple sclerosis, atopic disease, that red line you see right there is allergy and asthma. So back in 1970s when they introduced high fructose corn syrup. As you can see, what it's done is our diet has increased our weight, which has increased our susceptibility to getting sick. So if we see these healthcare trends, why do we keep thinking that we can do the same thing and expect better results? That doesn't happen. So what we're doing is we're following healthcare trends, we're tracking them, and we're saying this isn't working, and so we're saying let's create something else. We now have the ability to make a new trend, and the Allergyworx program is a perfect example of that. So that was training 1. Hello and welcome. My name is Andrew Ledford. I'm going to be walking you through the training module